Medical nutritional therapy of kidney diseases and gout. The incidence, which means the number of new cases per population, for chronic kidney disease CKD, diabetes at the top of the list occurs in 40%, and then we see hypertension in 27%. One of our aim of medical nutritional therapy in CKD is to minimize the impact of other comorbidities on the progression of kidney disease. What do we mean by comorbidity is the existence of other disease that can affect the function of the kidney, as diabetes and hypertension, for example. So we want to treat hypertension and control diabetes to minimize the progression of kidney disease. In patients with hemodialysis, we can give higher protein. Processed food contain high rate of sodium for preservation, so must be restricted. The clinical picture of nephrotic syndrome includes proteinuria, low serum albumin levels, edema, elevated blood levels of lipids, and blood coagulation disorders. One of the clinical picture of nephrotic syndrome is edema, and we may need to use loop diuretic to treat it, which leads to loss of potassium. So to compensate, we need to give potassium-rich foods. Gout is a hereditary abnormal metabolism of purine in which there is hyperuricemia resulting in the deposition of urate and sodium in tissues. The main tissues involved are the joints, and the main joint involved is the first metatarsal phalangeal joint, or the big toe as we see in the picture. Stages of gout includes asymptomatic hyperuricemia, in which there is only elevated level of uric acid in blood with no clinical picture. And there is the acute attack, which could be frequent or infrequent. Between the attacks, the patient had no clinical picture. And the chronic gout, in which there is tophi. Tophi, or the tophus, is the deposition of urate, sodium, in soft tissues, as we see here in the fingers, or even in the helix of the ear, which is sign of chronic gout.